Hello everyone, I am Mishika and today we are with Dr. Priyadarshi Amit, who is an orthopedic surgeon in upper limb surgery. So let's get some insights from him. So doctor, I have a question that what is shoulder dislocation and why it happens uh, quickly and early?
It happens because of injury most commonly, and sometimes it can result from your loose joints. But most commonly, it's because of injury. You have a fall, either in the house or sometime while doing your sports. Majority of the sports they do keep falling here and there, and then this is one of the things that they can have.
So it is because of age also or just because of injury?
I wouldn't say that it's because of age. It has to be some extreme force because your shoulder joint is stable because of your ligaments and all. So to dislocate it, you need that much force, and that much force comes when you fall over or some sort of forces.
So it can happen because of only because of the injury only,
Yeah,
right?
mostly because of injury. I don't say that when you grow old, your shoulder dislocates. No, that's not the problem we see in elderly population. Rather than we see that when you grow older, your joint degenerates, so you have arthritis, or your muscle degenerate, then you have rotator cuff tendon tear.
So, doctor, what is derma allograft?
Yes, so dermal allograft is one of the innovative design, one of those safeguard the doctors, to bring the good results to the patients. So it's used as a augment. So for the torn rotator cuff muscles, you repair them. So I repair them, but sometimes we do fail because you repair them, they tear off again. So to prevent the re-tear, we put an augment on the top of the repair. So that's called your patches. So dermal allograft patch is one of the patch which we have used in our patients. I had loads of patients where I have used them. I had good experience with them so far, and I think in selected patient I'll be still using this patch.
So the tear can happen even after the surgery of the patch surgery.
Yes, I mean you can take an analogy of something like a weak cloth. So if you're trying to stitch a weak cloth which is like shredded, and if you pull them apart, what's the chances that they can tear off again? And instead you get a strong a sheet that you stitch them, a new sheet, then there is a less chance that they can tear off. So that's why when we do a repair in the rotator cuff tendons, if they're like poor quality, and when you push them, when you pull them, like when you try to lift them, extreme force generates on the shoulder, they can tear off again. So to prevent that, we put a patch on the top, then hopefully it doesn't tear off.
So, is there any chances of infection after the surgery because you are using other person's skin or the person?
No, good question. So, even my personal experience, I did not have any increased risk of infection if I'm using a patch, or in worldwide, there is nothing like they have almost same rate of infection if you do not use patch. So, whether you use patch or not patch, and I don't see any difference. But in certain cases, like when you use a different kind of patch, they did have some reactions. Not the human, but someone else's. Then it does react a bit.
So, is it about like people who are diabetic can have infection after the surgery?
So yes, in diabetes, there is a theoretical risk of higher risk of infection. Now again, it depends on how good the diabetic control is. If like is sky high sugar, HbA1c is too high, then of course we may expect infection. But again, the shoulder surgery which we do, we are talking about rotator cuff repair with a patch or without a patch. That's like a very tiny incision we put. We don't cut open the skin a lot. It's like half a nail size. We call that keyhole surgery. You know how small the keyhole is. So there is not much risk of infection.
Doctor, there are any tips that you want to give to youngster who are sitting in like in front of laptop screens and phone screens all the time? Their shoulders are paining, their necks are paining.
So in younger generation, or I mean, IT professional, a lot of my patients are IT professionals. So they do have these issues of neck pain, scapular pain, trapezius pain. So I think I always say don't take any medicine for a long time. They get into a habit of taking pills every time and keep working on the laptop. So you have to correct your posture. So increase the height of your laptop. Keep it high. Keep your shoulder at rest, something like that, so that you're not hunched forwards. You have to make an army man position, chest forwards, shoulder buried backward. But I think if they maintain their posture, if they do their exercises, they don't need to see doctors. But in elderly population, when we see this tear, I think majority of the patient will not need repair if they start working on their muscles. So they have to maintain their strength in the muscle. And if suppose you do have issues, uh, you done exercise do not improve, then don't shy away from surgery. I think in our community still people are scared of the word surgery. I mean, it has happened with me. Like when I utter the word surgery, the patient run off my clinic. But there is nothing to be scared of from surgery. It's meant to improve the quality of the patients. We always take care not to do surgery in those patients where we feel that okay, there is a high risk of surgery, then we do not perform surgery. But in
So
those
if
cases who are fit, they should.
so if the shoulder dislocation is happening again and again, it's need to be do,
Yes,
uh,
I strongly recommend that they should get it fixed,
so
because you know, and
there is a need for
yeah,
surgery.
there is definitely need for surgery because they don't have issues now. But if they spend like 5 years or 10 years, they're gonna land up in such a trouble that when we can't do anything, because they will get arthritis, and thereafter it becomes very difficult for us, very challenging for us to improve arthritis at that age. Because for arthritis, I do joint replacement, but I don't want to do that in 30 years old guy, because your joint replacement is going to last you 10, 15, 20 years, and you don't want to have those surgeries at 30 age.
Thank you, doctor. It was nice meeting you,
Thank you very
and we
much.
had a great time talking to you.
Thank you very much.
Thank you.